I'm Professor Dr. Vivek Gupta, cardiologist, Delhi Apollo Hospital in Geo Convention Center. Today we are having a conference of National Intervention Council in Mumbai in Geo Convention, and this is the 40th meeting. I'm standing with one of the stalwarts of interventional cardiology from Switzerland, Dr. Bernhard Meier, and he is a great friend, and because he started some very innovative procedures way back in 90s, when the stent came in picture quite a big way with Patrick Serraz and yourself and Antonio Colombo, Alan Cribier. So they were the stalwarts, Jafajade, Jamarco. All these people are stalwarts, and he's one of those people who has started doing, and he's from Switzerland. I just want him to speak a little about what he contributed during the interventional cardiology, because we learned at that time and now we are practicing in India. I am in Apollo Hospital.
Well, thanks, Vivek. Very kind words of you. Of course, my contribution was that I found the world's first PCI patient in 1970 when Andreas Grünzig was looking for a patient for quite some time. I just happened to take care of a young patient with single vessel disease. I presented the patient to Andreas Grünzig, and he said, this is the first patient I'm going to do angioplasty on, and he did. You know, getting the consent was very easy. Andreas Grünzig told him, you're going to be the first in the world where I'm going to dilate the coronary artery, but if I don't do it, you're going to need bypass surgery, and if I fail, you can still have bypass surgery, so you cannot lose anything. And of course, the patient immediately consented. And by the way, he's still alive and well. I'm going to see him next week. We have a reunion. He's 86 now and has never had bypass surgery in his life. I did redilate some of his lesions twice, so he had 3 PCIs in 48 years of follow-up after the world's first PCI. So having been there at the right moment was my big thing in coronary angioplasty. I then went with Grünzig to the United States. I came back to Europe to practice angioplasty, and in the past, you know, my biggest mission that I'm still on is to promote closure of the patent foramen valley, which I think is a much underused technique, and also closure of the left atrial appendage.
LAA closure.
Yes.
I did not know, this is very strange and it's big news to me. The first patient done ever in the world by Andreas Grünzig was your patient, and you were scrubbed in that patient?
Yes.
You were scrubbed as a second operation?
Well, scrubbed is maybe a bit, Grünzig actually did it all by himself. I held the groin afterwards, so I was involved in
So how was the age difference between you and Grünzig?
He was born in 39, I'm born in 50, so we were 11 years apart.